The heart, a pumping organ which contains 4 blood-filled chambers. Surrounding them is a layer of specialized muscle whose fibers retract rhythmically throughout life to produce the heartbeat. The heart is similar in size and shape to the clenched fist and lies roughly in the center of the chest. It nestles between the lungs and sits on the diaphragm, the muscular sheath between chest and abdomen. From the heart, blood vessels spread and subdivide many times, reaching every part of the body. The beating of the heart keeps the blood moving continuously through these vessels and so creates the circulation. Although the arrangement of vessels throughout the body appears elaborate, the movement of the blood can be described as 2 linked circuits, one through the lungs and the other through the rest of the body. When oxygen is breathed in, it enters the lungs and is picked up by the blood, which transports it to all the cells of the body. Here it is combined with food substances to produce energy. Carbon dioxide is released by this process and is taken up by the blood, which carries it to the lungs, where it is breathed out. The heart chambers consist of a right and left atrium and a right and left ventricle. At the exit of each chamber are valves which ensure that the blood moves in one direction only. The blood returning from the body enters the right atrium and then moves to the right ventricle, which pushes it through the lungs. It returns to the left atrium and then to the left ventricle, which pushes it through the main artery, the aorta, and into the rest of the body. The pumping action of the heart is achieved by simultaneously contraction of the atria followed by simultaneous contraction of the ventricles. The contractions are initiated electrically by highly specialized pacemaker cells in the right atrium. The complete process is called the cardiac cycle or heartbeat. When resting, a healthy person normally has a heart rate of between 60 to 80 a minute. During exercise, the heart rate can rise to 160 per minute or more. Whatever the activity, the heart must pump continuously to sustain life. In order to do this, it requires a rich blood supply to its muscle. This is delivered by the coronary arteries, which branch from the aorta almost as soon as it leaves the heart. At this point, the blood has just returned from the lungs and is rich in the oxygen needed by the hard-working heart muscle. In coronary heart disease, these vessels become increasingly narrowed by a buildup of material in their inner layers. The deposit is known as atheroma and is largely composed of cholesterol and scar tissue. Cholesterol is a fatty substance or lipid and has many important functions in the body. Some cholesterol is derived directly from food, but most is produced in the liver from saturated fats. Along with other lipids, it is transported in the blood surrounded by protein. Such a particle is known as a lipoprotein. Low-density lipoproteins deliver cholesterol to cells. 70% of the cholesterol in blood exists as low-density lipoprotein. Also present in the blood are high-density lipoproteins, which can pick up cholesterol and ferry it away from the tissues and back to the liver. In a healthy person, these delivery and collection systems are well balanced. Disturbance of the balance with the relative increase in low-density lipoproteins may therefore cause cholesterol to accumulate in the tissues. The inside of an artery is lined by flattened cells. It is damage to this lining which seems to initiate atheroma formation. The causes of this damage are uncertain, but smoking, high blood pressure, diabetes, and other factors have been implicated. Once the damage has occurred, cholesterol may penetrate the weakened lining and build up in the vessel wall. Scavenger cells called macrophages are attracted to the region, enter the vessel wall, and fill with cholesterol. Platelets, specialized cell fragments involved in blood clotting, collect on the vessel surface, where the underlying layers have been exposed. Damaged lining cells, macrophages, and platelets can all release substances which can affect artery wall muscle cells and cause them to invade the region, multiply, and produce scar tissue. Platelets can also stimulate blood clotting in the area, and this aggravates the condition. Various substances continue to be released, attracting more cells and accelerating the disease process. A partial blockage of the coronary arteries can reduce the blood supply to the heart muscle sufficiently to produce pain in the chest and surrounding areas. This is called angina pectoris and usually happens when the heart's requirement for blood increases and cannot be met by the narrowed coronary arteries. This may happen during exercise or emotional stress. Angina may also occur when there is spasmodic contractions of the artery. It is not clear what triggers this spasm, but it may occur in the presence or absence of atheroma. With advancing disease, atheroma can expand to almost completely block a vessel. In certain cases, muscular contraction of the artery wall can reduce the remaining gap still further. Sometimes the surface of the atheroma can split and expose its interior, causing blood clotting or thrombosis. In this situation, particles can break off, float away and lodge further down the vessel. A clot may also completely block a vessel. Whatever the cause of vessel obstruction, the region of heart muscle downstream may be starved of blood and eventually die. This death of muscle is known as myocardial infarction or heart attack. New Image International, a New Zealand-owned health and lifestyle company founded in 1984, were aware many years ago of the ongoing factors of an unhealthy diet, stress, smoking, pollution, and other associated inflictions which are directly related to heart disease or coronary heart failure. Their ongoing commitment to excellence and product development have realized the need for the development of a new product called Circulytes. Circulytes are an advanced two-part formulation designed to help maintain the optimum functioning of the cardiovascular system. The power of Circulytes is based on the traditionally accepted benefits derived from herbal remedies and essential fatty acids that assist the cardiovascular system through reducing resistance in the veins and arteries and easing the strain on the heart. They have shown to be effective in reducing plaque and cholesterol, also helping the blood platelets and corpuscles to retain their elasticity, which deteriorates with age. Platelets and corpuscles may become so rigid they are unable to pass through the body's fine capillaries. Symptoms of this condition are reflected in coldness at the extremities of the body, such as cold hands and feet. Cardiovascular diseases have reached almost epidemic proportions among adults in the westernized industrial nations of the world, which in turn has converted our hearts from being essential pumps for life to ticking time bombs for cardiovascular disorders and ultimately serious disease or infarction. The powerful agencies of the advanced two-part Circulytes formation are Ginkgo biloba, considered by the Chinese to be the incredible plant of youth. Ginkgo prevents blood clotting, removes blood congestion, improves blood flow to the brain and peripheral vessels, plus Ginkgo lowers cholesterol levels. Ginkgo extracts have been licensed in some European countries as remedies for the treatment of memory loss, tinnitus, headaches, and anxiety. Haudiako, an ancient herbal remedy taken from a tree bark extract found in the Amazon rainforest, used extensively in Inca medicines to treat cancers and infections. Rutin is obtained from buckwheat and also the flower buds of the Chinese pagoda tree. Rutin has been widely used in the treatment of diseases characterized by capillary bleeding or increased capillary fragility. Bioflavonoids, commonly known as vitamin P, can increase the resistance of the capillaries and reduce their permeability to red blood cells. Crataegus, better known as hawthorn, normalizes blood pressure by normalizing heart action. Extended use will actually reduce blood pressure and is also excellent for heart muscles, which may be weakened through age or inflammation. Cayenne is used to increase blood flow to areas of the body afflicted with rheumatism, arthritis, pleuritis, or pericarditis. White willow bark contains salicylates, a natural base for aspirin, more widely known as a painkiller, but equally widely used by modern cardiovascular specialists as an anti-clotting and blood-thinning agent. Garlic. The value of garlic has been appreciated for centuries. Egyptian rulers ordered that a daily ration be fed to the pyramid builders. It is recommended as a natural antibiotic, immune system booster, and blood cleanser. Fish oil omega-3. Research has conclusively shown the benefits of improved health obtained from the essential fatty acids contained in pure fish oils. Omega-3 prevented blood clotting, allowed blood to flow smoothly, lowered levels of neutral fats and cholesterols, and made cells more pliant and lively. Borage oil, omega-6, is extracted from the seeds of the borage plant and is recognized as nature's richest source of gamma-linolenic acid, GLA, a rare though essential fatty acid. Borage oil has been shown to contain up to 30% of pure GLA and has shown to have significant benefits for males and is especially good for stressful situations. Evening primrose oil, omega-6, named the magical medicine, used traditionally by Native American cultures, has shown to regulate blood pressure, assist cell structure growth of the cardiovascular, nervous, and immune systems, as well as assisting the reduction of blood clotting and the maintenance of a healthy skin. Wheat germ oil, a natural antioxidant that strengthens the heart against disease. This plant's reputation is known as the staff of life and is considered to be nature's richest vitamin E source. Rosemary oil is an antioxidant that prevents oxidization and deterioration of the all-important fish oils contained in each Circulite capsule. Circulytes are a dietary supplement with a health benefit you cannot afford to miss. Another leading-edge product from New Image International, a company with a commitment to providing preventative and precautionary measures, leading to total well-being. Circulytes from New Image International, your health and lifestyle company of the future.